Are you overlooking a problem that sends about 92,000 Americans to the hospital and drives 1.3 million emergency visits each year?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're talking about chronic constipation, how common it is, why many treatments miss the mark, and the specific triggers you can evaluate so you aren't stuck cycling through laxatives without fixing the cause.
I'm Alara Skye. Constipation is widespread, yet many people keep quiet. Surveys suggest that only about 38% of those who've struggled with it ever bring it up with a clinician, and guidance can vary widely. You're not alone if you feel dismissed or embarrassed, but this is a solvable problem once you look beyond a one-size-fits-all approach.
Let's set the scope. Studies estimate 9% to 20% of adults qualify for chronic idiopathic constipation, with an average around 14%. Idiopathic means the cause is listed as unknown, which is striking given how often clear contributors show up when you take a thorough history: diet, medications, thyroid status, anxiety levels, daily routines, and even the way you sit on the toilet.
You may be pushed toward testing that doesn't help. Nearly half of patients who seek care end up with a colonoscopy for constipation alone, despite guidance that it shouldn't be an initial step without alarm signs. In one series of people scoped solely for constipation, no cancers were found and advanced lesions were rare. Overuse adds cost and real risk while delaying practical solutions.
The toll is more than inconvenience. Slow transit shifts your gut microbiome toward dysbiosis. Small intestinal bacterial overgrowth often tracks with impaired peristalsis, and improving motility can help. You might notice fatigue, headaches, abdominal pain, nausea, or vomiting. Chronic constipation correlates with diverticulitis, kidney disease, colorectal and gastric cancer, ischemic colitis, and even Parkinson's disease.
Many people reach for laxatives. Occasional use can be reasonable, but long-term reliance can blunt normal reflexes and trap you in a cycle of needing more to go at all. Some individuals react poorly to common products like polyethylene glycol. With delayed transit, you can absorb more of it and experience toxicity. Treating symptoms while ignoring causes keeps your gut from recovering.
Start by screening for red flags. If stools are progressively narrowing with unexplained weight loss, anemia, or rectal bleeding, you need an appropriate cancer evaluation. Remember that red meat and beet juice can also color stool, but don't guess, test. Once danger is ruled out, go down a clear checklist to find what's actually slowing you down.
Thyroid function matters. Hypothyroidism commonly shows up as hair thinning, cold intolerance, fatigue, weight gain, and slower bowel transit. Hyperparathyroidism is more common than many realize and can bring diffuse pain, cognitive issues, arrhythmias, kidney stones, fractures, and gastrointestinal symptoms, including constipation. If your story fits, ask for targeted evaluation rather than another round of over-the-counter remedies.
Your nervous system and mood can be direct drivers. Anxiety and depression are overrepresented in constipation, with mechanisms that include brain-gut axis changes, higher pelvic floor muscle tension, microbiome shifts, stress hormones, and sympathetic activation that slows transit. Mind-body practices that genuinely relax you, along with psychological support, can make a measurable difference.
Medications are frequent culprits. Opioids top the list, but antacids, anticholinergics, antidepressants, antihistamines, antipsychotics, calcium channel blockers, certain blood pressure drugs, NSAIDs, and even supplements like iron and calcium can constipate you. About 1 in 10 people on iron report constipation. If your symptoms began after a new prescription or supplement, discuss alternatives or timing changes.
Diet is often decisive. In children, removing dairy helps a large majority who don't respond to laxatives within weeks. Mechanisms may include allergy and opioid-like peptides in dairy. Gluten contains peptides with similar effects and has been shown to slow transit and trigger constipation in some. Beyond those, individual triggers vary. Common reports include cow dairy, gluten, goat's milk, red meat, legumes, eggs, fried foods, white rice, unripe bananas, chocolate, excess caffeine, excess alcohol, and excess tea.
It's not just what you eat, it's what you're missing. Dehydration hardens stools and can stall peristalsis. Restoring fluids can rapidly soften and restart movement. Mineral gaps, especially magnesium and sometimes potassium, can contribute. If you recognize low fluid habits or cramping that hints at electrolyte issues, address those fundamentals as part of your plan.
Gastrointestinal function deserves attention. Low stomach acid can coexist with reflux, nutrient deficits, food sensitivities, and pathogenic overgrowth. Restoring adequate acid and treating reflux appropriately can help constipation. Hormonal shifts, pregnancy, menopause, or hormone therapy can change bowel patterns. If that applies to you, coordinate with a clinician who can balance hormones while monitoring GI effects.
Daily habits can lock the pattern in place. Ignoring the urge to go makes the next attempt harder. Many people notice they do best if they allow time in the early morning. Some traditions point to a 5 to 7 a.m. window when the colon seems most active. Sedentary routines dampen peristalsis. Consistently moving your body helps your gut move too.
Position matters more than most realize. Sitting on a modern toilet compresses the rectum and works against a smooth bowel movement. Squatting aligns your anatomy for easier passage, which is why many people report relief when they use squat toilets while traveling. If you've never tried a true squat, this single change can feel like flipping a switch.
You'll hear, "Eat more fiber," as a default answer. Sometimes it helps, but not always. And some of fiber's benefits come from directly stimulating peristalsis rather than bulking alone. If fiber worsens bloating or slows you further, shift focus to the other levers we've outlined and return to fiber once transit is improving.
Pull this together into a personal plan. Identify any alarm signs and rule out serious disease. Review medications and supplements started before symptoms. Trial removing dairy and, if needed, gluten to see if your transit improves. Rehydrate consistently, correct mineral gaps, and address anxiety with practices that calm your system. Reassess hormones if your timeline fits. Move daily, respond to your urge to go, and try a squatting position.
Here's today's challenge. Over the next 7 days, keep a simple log of your bowel patterns, fluids, medications or supplements, and diet. Choose one likely driver, such as a dairy trial, better hydration, a daily movement routine, or using a squatting position, and apply it consistently. If you see progressive narrowing of stool, unexplained weight loss, anemia, or bleeding, escalate to medical evaluation promptly.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.